Hi, I'm Ken in Celtik. I'm a reconstructive urologist at the Crane Center for Transgender Surgery. Today, we're going to talk about some common questions that I get from people interested in feminizing bottom surgery. I often get asked, what's a consultation look like? Well, during the course of a consultation, usually it kind of starts off as sort of 21 questions. I'm going to ask you all sorts of questions about your history of your transition, your past medical history, any sort of comorbid conditions that you might have, or diagnoses or hospitalizations. I'll ask you about every single surgery you've ever had. Want to learn about how they went and what they were and when they took place. We'll also talk about any sort of medications that you take, allergies. We'll talk about your social history, which includes things like tobacco use or drug use or alcohol use. Talk about any sort of family history of any sort of health problems that might be relevant or important for me to know about before surgery. And then we'll talk about you. We'll talk about your goals for the surgery and what you're trying to achieve, and make sure that we can personalize this procedure as best as possible to make sure that you're satisfied at the end of your surgery. Common question is, what is the process like after a consultation? So after a consultation is done, you'll often leave the appointment with something that feels like a bit of homework. You'll need to collect letters of support from mental health care providers and your hormone provider. Hair removal is likely a part of something that will be necessary to be done before surgery. You'll also have certain clinical goals depending on what sort of pre-existing medical problems or prior surgeries or other medical issues that may be unique to you that you may have goals to establish prior to scheduling for surgery. When patients come in consult with me, they always ask me, like, how painful is this surgery? Or, what's the pain like? As with any surgery, surgery hurts. There's a knife, anytime you make a cut, it hurts. And there's a certain amount of healing process, and healing also hurts. With that being said, this is a huge surgery, but I will say patients are surprised by how well managed their pain is after this surgery. You'll be up walking around the morning after surgery, and you'll only spend 2 or 3 nights in the hospital, and you'll be walking right out of the hospital on the day you leave your hospital and walking into my office the week after surgery, for your first post-op visit. So the truth is patients do really well. They do often need pain meds for right after surgery and for the first few days, but within a week or two, I'd say the great majority of patients are coming off of their pain meds or only using sparing amounts of just common over-the-counter stuff like acetaminophen, Tylenol, and Advil. The recovery after bottom surgery, it depends on the individual, right? Everyone has a different kind of, different history. Some people have had a lot of surgery and some people have had none at all. And kind of your prior experiences with surgery will in some ways shape your recovery process, as could your comorbid conditions, like if you have any other diagnoses or any other functional limitations and how you get around. With that being said, the day after surgery, you'll be up out of bed, walking around. A week later, you'll be in my office, walking right in, and we'll take out your urinary catheter. You'll be peeing and on your own, and quite honestly, the recovery process is quite fast. By 2 or 3 weeks after surgery, you'll be feeling really well. And, some individuals even go back to work within a month or 2, depending on the type of work that they do. A common question I get about robotic peritoneal flap vaginoplasty is, what makes an individual a good candidate for this surgery? It's a multifactorial question, but what really makes it best, what separates this technique from others is that, oftentimes patients will seek out this type of surgery as opposed to penile inversion vaginoplasty. Often it'll be because they're concerned that they don't have enough external skin, or that they have less external skin that they would like to create all of the external features of their vagina, as well as be able to line their vaginal canal. And so robotic peritoneal flap vaginoplasty is a great option for those individuals because we're able to access tissue deep inside your belly to construct your vaginal canal from it, and then, able to kind of, in some ways, keep outside the skin that already is outside, so that we can create all those external features of the vulva, like the labia, minora, and others. Another common question is, when can I have sex after surgery? For the first 3 months after surgery, I tell patients to just totally abstain from any sort of sexual activity or masturbation, to just allow their anatomy to heal and to, take its time, right? This is a huge surgery that you're undertaking. Well, thank you for watching this video today. Again, I'm Kenan Celtik, a reconstructive urologist at the Crane Center for Transgender Surgery in the San Francisco Bay Area. If you're interested in learning more about robotic peritoneal flap vaginoplasty, or scheduling a consultation with me or any of the other surgeons here at the Crane Center, check out our website at cranects.com, or give our office a call. Love to see you.